I'm Frank Downey. I'm the Surgical Director of Cardiac Transplant and Mechanical Circulatory Support here at Aurora St. Luke's Medical Center in Milwaukee. Here at St. Luke's, we have a long history of success in cardiac transplantation and mechanical circulatory support. The first cardiac transplantation was done in 1968 here at Aurora St. Luke's Medical Center. Since the program was restarted in 1984, there have been nearly 800 transplants performed at St. Luke's Medical Center. 600 of these patients have been supported with mechanical circulatory support devices. We use mechanical circulatory support devices as bridge to transplantation and as destination therapy. Destination therapy is the permanent, definitive surgical treatment of heart failure for patients who may not be a candidate for cardiac transplantation. Those patients over 70 or recent history of cancer, or those patients who just don't want to go down the road of a cardiac transplant. These end-stage heart failure patients have a significant risk of dying in the next year. If the patient becomes a transplant candidate and is listed for transplant and survives their transplant procedure, they then have a 50% chance of surviving 10 years, whereas without the procedure, they probably won't survive another year. Since 1984, our cardiac transplant program has been very productive. We are on the verge of celebrating our 800th transplant procedure. What that 800 number means is 800 families of those patients who have supported that person through end-stage heart failure, through their transplant operation and their recovery. It also represents 800 donor families who made the ultimate sacrifice to donate a heart at the time of incredible grief. It is very difficult for a family to commit to organ donation unless it's talked about ahead of time.